It's Jason from drpremed.com. I want to talk to you a little bit about preparing academically, getting ready for any exams or tests that you have taking place, and a strategy that you can really use to show that you know the material, that you're not going to go into your exam feeling like that you don't know what you're doing or that you're going to miss points on a test. And this is a very basic, easy strategy that you can do. And what you need to do is after you study something, you need to make sure you can teach it to somebody else. If you can't teach it to someone else, that means you don't know the material well enough. You need to go back, review it, and pick up the finer points. And what's going to happen when you're teaching it, you're going to kind of synthesize things in your brain as you have to talk it out, and just hearing your voice talking things out consolidates what you're trying to learn. And also, as you're talking, you realize if there's gaps in your knowledge, if there are a lot of pauses, or things just don't seem to be making sense. That tells me, and it should tell you as well, that you don't know the material that's good at a good enough level to do well in your exam. So I highly encourage you to start using the strategy to start improving how you're doing academically. It's going to show whether you have command of the material. And when you're teaching it to somebody else, it doesn't have to be very super in depth, but it has to be where you're using the appropriate words based on the topic. So at the level of your pre-med student, make sure that you're using a lot of those science words that you're going to see on the MCAT, and basically use the terminology that's used on the test that you're preparing for. Because the one thing in medicine and science in general, you can't be general in your word choice. You need to be very specific, because words have different meanings and connotations, and to somebody who's knowledgeable and an expert, if you just use a vague term, that's not going to get you points on your exam, because the test writers can be very specific in what they're looking for in regards to an answer choice. And you need to start preparing for this now by making sure you're using appropriate words when you're explaining and you're teaching things to other people. And if you're able to do this on a consistent basis, you're really going to start seeing your scores move up. They're going to start jumping to the top, because you're really consolidating what you know. And it's not like, oh, I just read this in the book, I have a good idea of what they're talking about, and I know it if I see it. No, you can't go into a test thinking you'll know it when you see it. You need to be able to have the words already preformed, already have the answers preformed, and the only way you can do that is if you can teach it to somebody. And so a lot of exams, they're multiple choice when you get into medical school and all of your boards. So the test writers know that. Students think, oh, I'll just look at the answer choice and be able to pick it out. No, the test writers actually put things in their answer choices that are made to fool you into thinking it's the right choice when actually it's wrong. But if you actually knew the material at the right level, then you would actually see the holes and fallacies in the question, so that you can answer the right answer correctly. So that's one thing that you need to be aware of. You have experts who make tests, and they know the common traps that students fall for, and I don't want this to happen to you. So I highly encourage you to go read over something in your textbook, and then make a short lecture on it, like 2 to 3 minutes, or even 4 minutes if it's a lot of material that you're trying to cover, and just see how well you're able to do that. And if you're able to do it with a classmate or somebody, if they have questions for you, then that's really going to know if you know something or not. And if you can't answer those questions, then you need to go back to the drawing board, read some more, look at some other sources, and make sure you can answer those questions just like how your professor would be in class. They don't just sit there, I'm not sure, I think it's this, or if you read it more, you'll pick up on it. No, you can't just give vague answers. You got to be very specific to the questions that are going to be asked of you. And once you're able to do this, you're going to be able to do great. And I look forward to you improving on all your exams going forward by using the strategy of being very aware of being able to teach what you learn to somebody else in an informal setting to consolidate your knowledge on a topic that you just covered. And again, this is Jason from drpremed.com.